better than placebo. No better than placebo. We have no drug therapy that has been trialed in a well-conducted, controlled clinical trial that has shown to produce significant benefit in cats with idiopathic cystitis. None whatsoever. There are a few drugs, I've listed them over here: amitriptyline, glycosaminoglycan replacers, glucosamine, pentazan polysulfate, and Feliway, where there have been some studies which have suggested that there may be a benefit in at least some cats by using these, but not on a controlled basis looking at a population of cats. So we have no drug that we can rely on to treat this disease. One of the difficulties, it has to be said, is that many of these drugs have been trialed on a short-term basis. And if you have a cat with a disease that's going to get better in, say, 5 days, it's asking an awful lot of a drug to make it get better quicker than that. That's why we so often use antibiotics in cats with lower urinary tract disease. We give antibiotics and the cat gets better, and we think it was the antibiotics that made the improvement. Well, it wasn't the antibiotics that improved the cat. We could have given the cat chocolate drops, or we could have given the cat whatever you like, and it would have got better. That's one of the challenges with this disease. We need to conduct long-term clinical trials over several months to look at recurrence rates to see whether these drugs genuinely benefit. But even where that has been done, with drugs like pentazan polysulfate, glucosamine, the use of Feliway diffusers, still on long-term clinical trials, they haven't been shown to produce a significant benefit at a population level. Still to date, as far as I'm aware, the only study that has shown a significant benefit through intervention in cats with lower urinary tract disease is an old study, and it's a study that you can certainly criticize on a number of different levels, but they did at least show a significant benefit. This was a study that looked at 46 cats with idiopathic cystitis, followed them over a period of 12 months. They were fed one of 2 different diets. With one of those diets, the recurrence rate was only 11%. With the other diet, it was 39%. Highly significant difference between those 2 groups of cats. And the difference between those 2 diets was simply that one was a wet diet and one was a dry diet. They were a wet and dry formulation of the same diet. The wet diet was producing a lower urine-specific gravity, producing more dilute urine, encouraging the cats to urinate more frequently. Factors that are probably important in the management of idiopathic cystitis. Diluting the urine, making it less irritant if there is abnormalities in the epithelial lining of the bladder, encouraging more frequent urination, almost certainly helpful in these cases. So based on available evidence at the moment, the one thing that we want to try and do with these cats is to maximize water intake, to feed tin food rather than dry food, and to encourage owners to think about ways that may encourage the cat to drink. Running water, tap water, water from the pond, rainwater, flavored water, whatever the cat prefers to drink, because cats have individual preferences the same as we do, encouraging water intake. But the other aspect too is stress. And stress is a factor with idiopathic cystitis. We know from studies that have been done that stress is a factor. Not many cats perhaps get suicidal, but I would imagine some of them probably are suicidal with severe recurrent idiopathic cystitis. So we want to try and address the stress that's going on in these cats as well. Single most important stress factor is probably aggression from other cats that share the same environment. Certainly there's one study that identified that as the major stress factor in cats with idiopathic cystitis. But we certainly want to look at this. And I'll just show you briefly the results of another study that was published more recently, this in Journal of Feline Medicine and Surgery from the group at Ohio State University, where they looked at what they called MEMO, multimodal environmental modification, looking at environmental enrichment as a part of management of cats with idiopathic cystitis. What they were looking at was a combination of client education, animate and inanimate interactions, in other words, encouraging owners to spend more time interacting with their cats to enrich the environment, encouraging owners to have toys that the cats can play with, modifying the environment, making sure that there are safe hiding places for the cats, enough resources, enough food bowls, litter trays, etc., and modifying the diet, changing from a dry diet to a wet diet. These were the major components of the multimodal environmental modification. They looked at a total of 46 cats. Most of these cats had pretty severe idiopathic cystitis. Most of them were having weekly episodes of idiopathic cystitis. And they developed a plan of environmental modification based on careful questioning of the owners, looking at the environment, examining the behavior of the cat. The things that were most commonly suggested were avoiding punishment of the cat. Again, changing to a wet food, changing the type of cat litter to unscented clumping litter, which most cats prefer, using deep litter in a litter tray, providing sufficient number of litter boxes, making sure that they're cleaned on a regular basis, providing climbing structures and perches within the home environment for the cat, scratching posts, perhaps leaving the television on or the radio on when the owner goes out for the cat, increasing the amount of time that the client spends with the cat, trying to resolve conflict in a multi-cat environment. Lots of different things. It's not a simple quick fix. It takes time. You need to understand what's going on. In a multi-cat environment, this is a typical history, a 6-cat environment, 6 Tonkinese cats, you need to spend a little bit of time. Work out which cats have friendly relationships, where the aggression might be occurring, what is perhaps triggering the aggression. Part of that is looking at the home environment, looking at the resources that are available in the home environment, perhaps drawing a little map like this. Where are the food and water bowls? Are the food and water bowls too close together? Are there enough food and water bowls for the number of cats in the house? Are there enough litter trays for the number of cats in the house? Are they in appropriate locations, or are they in locations that are going to discourage the cat from using the litter trays? These are important things when it comes to looking at the environment. Lots of other things that can be done. In this study, the owners were also given a copy of this book from the cat's point of view, just so that the owners could understand a little bit more about life from the cat's point of view. So in this study, most commonly followed recommendations were physical changes to the environment, increasing the amount of time that the owner spent with the cats, changing to a canned diet, and then adding in additional litter trays, changing the locations, and increasing the frequency of cleaning of the litter trays. Results in this study were quite remarkable. This wasn't a controlled study, so there wasn't a control group to compare it with, but you need to remember that most of these cats were having, on average, at least weekly episodes of idiopathic cystitis, and after 10 months with this study, 75% of those cats were having no recurrent episodes at all. So very significant reduction in the number of episodes of idiopathic cystitis. And interestingly, a lot of other significant changes as well. Decrease in fearful behavior, decrease in nervous behavior, decrease in other clinical manifestations which may be reflection of stress as well. So a lot of changes that were very positive as a result of instituting environmental enrichment combined with changing to a tin diet. So in terms of treatment of idiopathic cystitis, at the moment, we don't have any magic drug therapy for this disease. It is not a disease where we should be looking at drugs to provide the answer. Analgesics may be helpful in the short term to provide symptomatic relief, but long-term control, our goals, our priorities should be changing to a tin cat food, encouraging water intake in whatever way that we can to produce greater volumes of urine and more dilute urine. We should be looking carefully at litter box management, the number, the type of litter, the depth of litter. Try and encourage the cat to urinate as frequently as possible. And we should be examining the environment and taking the time to explore that properly with owners. Talking to owners about the things they can do to alter the environment, to enrich the environment for the cat. And if we do that, the vast majority of these cats we can actually manage very well. Very few of them will we have to resort to long-term drug therapy. If we have to use drugs, probably my first choice to try would be glycosaminoglycan replacers because it's perfectly safe. There may be some cats that might benefit from that. Maybe amitriptyline, second choice. But again, if we've done things properly, we probably very rarely then have to play around with any other drugs that we really have no idea whether they have any clinical effect in this disease or not. So I hope that's been valuable. I'm sorry that we've had to rush through some of that fairly quickly, but I hope there's been some valuable tips for you. But at least it gives you an idea how we approach management in my clinic. Thank you very much.